ever been tested for autoantibodies? They're used to identify somebody who's at risk for type 1 diabetes. I'll explain this a little bit more. Autoantibodies are abnormal antibodies that target our own tissue. And when it comes to type 1 diabetes, these autoantibodies, they can trigger that autoimmune reaction that attacks the insulin-producing cells in our pancreas. There is a blood test that we can use to get screened for these autoantibodies, and it's helpful because, yeah, genetics can play a part in having type 1, but about 90% of all of us with this genetic predisposition, we have zero family history of the disease. Like, nobody in my family has type 1 except me. The test can help us prevent DKA, diabetic ketoacidosis, and that's why this is so helpful. You might be torn on whether or not you should get the test or have your family tested, and I get it. It can be stressful. So many people have said they would rather have known than not known at all because they're more ready for the shock of a type 1 diabetes diagnosis. Tomorrow, we'll talk about the ways that you can get tested.